today's episode of the Girls in Action podcast. I'm Brianna.
This is Melissa.
I'm Naya.
And I'm Nava.
So we're going to be hosting this episode today, and we're so excited to be talking with y'all. So I don't know about the rest of you guys, but I just started school a few weeks ago, and it's been super weird for me starting my senior year on Zoom. And it's been pretty tiring being on the computer 8 hours a day. And the fact that I have no idea when it's going to end has been super hard. I don't know about you guys, but how's school going for you?
Yeah, it's honestly so weird. I had my orientation today on Zoom for 4 hours straight, and I was just sitting on my bed, and I just realized that we're going to be so tired, and I don't know how the younger kids can do it, especially kindergartners and preschoolers. It's really hard to stay engaged online, and I feel like I need, a physical classroom.
I feel like it's going to be hard for teachers, too, especially with little kids.
Exactly.
I just started school 2 days ago, and after a full day of Zoom, you feel really tired and worn out, but I think that everyone's realizing that we're all in this together, and the teachers are giving us some Zoom breaks and time away from the screen, so that's been pretty good.
And there's that community support, I think, of everybody's kind of understands. I guess even though we're all in different boats in our own ways, I think we all kind of have that shared trouble or whatever.
Yeah, collectively, I feel that.
What about you, Nava?
Actually, I don't start school till September, so.
Wow, lucky.
Yeah. Well, we end late too, so.
Oh, that's nice. All right, so I just also wanted to mention standardized testing. This might be more applicable towards those in high school, but I feel like ACT, SAT, those tests can really, all of those being canceled for the majority of this year, that just makes it really hard for students because they've been preparing for such a long time. And I feel like the fate of the college admissions process is going to be so different from now on, because now you really don't have some sort of score to base admissions off of. And personally, I feel like that's a great change because a number does not define you at all. So yeah, I don't know how everybody else feels. Especially for me, I'm going to actually be taking the ACT sooner, later this year. But I'm a little worried because I fear that my test center will be canceled because COVID might still be going on. But I don't know. What does everyone else feel? Even if you're in middle school, there's probably some sort of uncertainty about the future,
For sure, I totally agree. I know that a lot of my classmates are applying for high school this year. High schools in the city have announced that they won't have the SSAT be their main source, what they'll look at, and some schools won't even require it. So that's a huge change in terms of high school applications and the whole process.
For sure, yeah.
The thing with the SAT, it just adds, I think, an extra level of stress because that's already a super stressful thing to be studying for and then having to take this super long test. And it's one of the biggest tests you'll take in your high school career, and in some ways, the most influential. And so I feel like it's just another thing adding to the stress, and that can be really difficult.
Yeah, I totally understand. Yeah. Especially for you, Brianna, because it's senior year, everything's going by in a rush,
Yeah, and you've always been kind of told, this school has this average SAT range, and then all of a sudden these schools are all saying, oh, we're not going to count SAT scores as much, or you don't have to turn one in, so you wonder how that's going to affect your admission or whatever. So yeah, it's been a bit of a concern, but we'll get through it, hopefully.
Yeah, hopefully things change, or I don't know, these standardized tests could be eradicated somehow and change for something else. But yeah, honestly, I just have a question and a follow-up question. Do you think it'll be harder or easier to get into a prestigious college? Probably this is applicable to Brianna and I because that'll be in the near future. But I think that it could be the same amount of getting into the same percentage, because I feel like they instead of using standardized testing, they'll probably use some sort of like maybe your essays or your extracurriculars or things that you have done to improve the community, something like that, right?
Yeah. I think it's totally depends on who you are too, because with the SAT example, if you're a really good test taker, that might be a hard hit for you if you can't take the SAT. But if you're someone who has really good grades and then also has other stuff behind them, like volunteering or whatever, when colleges are going to be taking a more holistic approach, it'll be maybe easier. It just kind of depends, and it's hard to tell this early on,
Yeah,
Everyone.
for sure. Yeah. So anyone else have any thoughts before, I don't know, I just kind of move it on to another segment? We good? All right. So I feel like COVID has really affected everybody in at least like one aspect of their lives. For example, it could be doing remote learning, or maybe having layoffs, or just even like lack of access to basic needs such as food or shelter or even PPE. And especially now, marginalized groups such as people of color, the LGBTQ community, low-income people, and houseless people have even been hit harder than others. So this leads me to today's topic. In today's episode, we're going to be highlighting some specific areas where COVID has affected people financially, mentally/physically, and especially how society has been affected in general by the pandemic. So yeah, let's get into it.
Before we get into the episode, I just want to let everyone know that we made a mistake in our first episode by bringing up Gandhi, because he beat up his wife and was not kind to women, and he wanted the Indian what he was doing with his Indian culture to be separate from the Black and colored community, and he wasn't very kind to them either. So just wanted to bring that up before we start.
Hi everyone. So I did some research on how intersectionality plays a role in the here and now, especially during COVID. People with disabilities are generally not at a higher risk of dying from COVID. It really depends on the type of disability you have. For example, someone with a physical disability could be at a higher risk of infection because of their underlying medical condition. Studies have shown that people with disabilities are treated differently because healthcare providers have negative views on patients with disabilities. Some people have assumptions on long-term survival for someone with disabilities. People with disabilities can be treated biasly in the hospital. So COVID plays a huge role within race. I'm going to lay out some numbers in terms of COVID deaths per race. So the numbers I'm going to say here are per 100,000 people. So for every 100,000 people, 83 Black or African American people die from COVID, 51 Native Indian or Alaska Native Indian people die, 49 Hispanic/Latinx people die, 35 Asian people die, and only 34 people die, in contrast to the other races I've just brought up. So to sum that up, Black people are dying at 2.4 times the rate of white people. Black people have the highest percentage of cases in the United States. In Michigan, Blacks make up 40% of the deaths from COVID statewide, but Blacks only make up 15% of Michigan's population. Whites make up 75% of Michigan's population and are 26% of the deaths from COVID. Why is that? Well, some Blacks are living in areas with a lack of healthy food options, not as many green spaces, recreational facilities, and not as much safety. Some Black people live in densely populated areas, making them more likely to make contact with other people. Blacks represent 1/4 of all public transit users, which means more contact with the outside world. Some Black people also don't have equitable healthcare access, which means hospitals are further away and pharmacies are subpar, which means you have to wait several days to receive urgent prescriptions. Healthcare risks are not because Blacks do not take care of themselves. It is because the healthcare resources are inadequate in their neighborhoods. Blacks are also more likely to be part of their essential workforce or frontline workers. Black people and their families can be overexposed from their daily interactions. So, police often stop Black people wearing masks in grocery stores or gas stations when they are just following safety precautions. Some sense potential criminal behavior if a person is Black, especially if they are male, from their biases and assumptions. A Baltimore police sergeant was under investigation after he was recorded openly coughing at Black residents while patrolling through a public housing complex. Black people who are simply trying to stay safe are being mistaken as criminals for the way they look. In terms of Black patients with COVID and how they are treated in the hospital, studies show they are treated with bias. Black people with COVID symptoms are 6 times less likely to receive COVID testing than white people who exhibit COVID symptoms. Black people receive smaller hospitals for a larger amount of people sick. Another race that is heavily impacted by COVID is the Latinx community. They are hospitalized from the virus at 4 times the rate as white Americans. 26% of the deaths in the U.S. are Latinx folks. Some reasons for this is because Latinx people are frontline workers, and they are overexposed to the virus the most. Latinx folks also have much lower rates of health insurance. Some of the Latinx population are immigrants and have limitations in terms of not being able to access health care. Indigenous people have also been hit by COVID-19 virus pretty badly. Many people have realized the COVID-19 virus could wipe away Indigenous people entirely. Indigenous people have a higher risk of emerging from infectious diseases than other populations. And in the U.S., 1 in every 2,300 Indigenous people have died from the COVID-19 virus, making them the second most at-risk ethnic category in the U.S. after Black Americans. Amazonian Indigenous groups are particularly vulnerable to dying from COVID-19 because they live days away from professional medical help. As of July 28th, the virus has killed 1,108 Indigenous people, and there have been 25,517 open cases, with the majority of those cases in Brazil. The U.S. often does not treat people of other races with respect, and during a time such as COVID-19, we need to be more equal than ever and put our differences behind us. Our main goal is to work to fight COVID-19, and it does not matter if we are helping someone who is Black, Latinx, Indigenous. We are all equal. We want to fight a common cause and not make more differences between us all.
Yeah, Nia, I really liked how you talked about how not only are people being physically, like, are they more likely to contract COVID, and in these times, you know, with healthcare and stuff, there's disparity. But I also liked how you mentioned underlying conditions and why they're more vulnerable, you know, things like inequitable housing where more people are packed into smaller spaces, and then that's been going on for a while, but then that's you know, carrying into COVID now, and kind of how that's affecting people in a different way now that there's this virus, or inequitable access to healthcare. And so yeah, I think you did a great job of highlighting that there are direct effects from COVID, and then there are also things that have been going on forever that are now just with COVID, they're being worsened. Like, I think you did great with that.
Thank you.
Yeah, so I was so shocked by those statistics. Like, I never expected, I don't know, I never imagined that. That's just so worrisome. But when the pandemic started, actually, I heard that in Italy and in certain Latin American countries, the hospitals were actually deciding which patients to treat and which ones to let die. And that was some sort of rationing of treatment, I guess. And I did hear that ableism, you know, their ability and also money played a factor in deciding who gets to stay alive. And that was so appalling.
Yeah. And then that also speaks to the problem of us not having enough PPE in general. why are doctors having to choose between lives? And then, because, I don't know if you guys have heard those stories, you all have heard those stories of like doctors having to choose between one person or the other, and then choosing the more able-bodied person because, like, for whatever biases they have. But why is that even a decision that doctors should be making? It's really sad, and I think we need to really look at, when we're in a global pandemic, how can we use what money we do have to kind of expand our resources and make sure that people are getting the things that they need, not only in hospitals, but I know Naya mentioned immigrants and immigrant field workers, and I think that's also a huge problem with them not having PPE. They don't have masks. And then with the fires, I know where we are, there's a lot of fire and smoke and bad air quality right now in California. And farm workers are still having to work to feed their families. So not only are they facing the fear of getting COVID, but they're also now having to worry about the air quality, and they're not having enough materials to keep themselves safe. So I think it's really important to highlight that, where are these resources and what can we do to help people have the resources that they need.
Yeah, I really like how you guys put that, and Naya, I really like what you highlighted and brought up. But I wanted to switch back to COVID and Zoom, and talk about some of the mental disorders that some kids have been having because of staying inside and not seeing everyone and being on a screen or in their house for this long. And COVID has actually caused mental health problems to teens, tweens, younger kids, and even some young adults. And they have been facing anxiety disorders, including general anxiety, social anxiety, worry, fear, and depression. And the depression and fear and worry is most of it is because of the fear of dying or others dying, or even just being diagnosed and what the treatment will be like, which is really sad to hear. And when schools are closed, children don't have the stimulation that is provided by the same environment that they're used to. So when they don't get that stimulation, it can cause problems. And not seeing friends or contacting with other people face to face, like your family, like normally, regularly, can mean less social support, which is very bad for your mental well-being.
Yeah, I hear you. And I think if there's inequitable access to technology too, it makes it really hard to connect with other people, which is something that's really essential right now. We're all missing social interaction, at least most of us. And so if people don't have access to the same types of technology, that can also be another way that there's a disparity, I guess.
Yes, and even when we're on the technology, it never really gives us the same feeling or stimulation as when we're with someone in person.
Yeah, I totally agree. I feel like for a lot of kids, not just for me, there needs to be some sort of sense of structure or normalcy, because I feel like that sort of school day structure really motivates me to continue my day. But now if I'm online during Zoom, I just feel all out of sorts, and it's just hard to create and maintain connections, or just, I don't know, keep up with your studies. It's just, you need to find some sort of other motivation to help you with that.
Totally.
I totally agree. I know that when we started distance learning, it felt so strange, and it was like there's so many distractions around me, and then when you get off your Zoom, you feel tired and depleted, and you don't get to see your friends. You have to see them over a screen. And it takes a really heavy mental toll on people. So I totally see how that can affect other kids and teens as well.
And as we're talking about that, mental toll of just school alone, then I start to think about too all the other things that are happening amidst the pandemic. There's Black Lives Matter is happening, and that's this huge social movement that's affecting so many people in really, it's painful and it's traumatic to have to feel this responsibility to call out people or to be raising awareness. And that's like more just responsibilities that people are feeling on top of their school. Is like, I have to be a part of this and I have to help, further this cause. And so that ties into kind of what we're talking about with COVID and how it's affecting people, like I guess in social spheres, how it's changing that. And yeah, so I think with BLM going on right now, there's an added stress, I think, for a lot of people. And it's like having to go through the whole day on Zoom and being tired and working in school and then having homework. And also, dealing with the fear and the pain and from seeing all of these things online that are hard, and they're very hard to combat because of how systemic they are. So yeah, thanks for bringing that up. And then, so I was gonna talk a little bit about some stigmas that are associated with COVID and how that can also be something else that's being added onto people's stress. I think in general, when there's a disease like this or something that's really contagious, it can be really, and something that's not super normalized, it can be, there's almost this fear of like, if I get the virus, my friends are going to be like grossed out, or my people that I know are going to be like, ew, she had coronavirus and it's going to affect me for a long time. So there's this general stigma. And then there's also stigmas that are being extended to people that are being grouped by their race or their class or their ethnicity. So one example that I've really noticed of this is surges in xenophobia and anti-Asian rhetoric. I don't know, have you guys seen anything like that in the news and stuff? There's just like headlines, and I don't know if you guys have seen that.
Yeah, I was seeing actually Trump say that it was the China virus, or some sort of thing like that, and that just really disgusted me because
Language like that is hurtful.
Yeah, it's so hurtful.
But yeah, so I've also seen like there's stories of Uber drivers seeing somebody who's Asian American and like refusing to give them a ride or whatever, stuff like that. It's just this unfounded falsehood. And so there are people who have been even living in the US their entire life, and now they're targets of this xenophobia too. And it's racist, and it's really hard to address that when, I don't know, it's just really terrible that people are experiencing racism. And so there's that anti-Asian rhetoric, but then the virus is also disproportionately affecting people of color, low-income people, as Naya was talking about earlier. She said not only are they contracting the virus more frequently, but access to healthcare and experiences receiving healthcare differ drastically. Those are social issues too, and they come from bias, whether it's conscious or unconscious. There are these biases against people of certain races that are totally contributing to pain that these people are feeling, especially with, I think about the Black people. I think that, like I was mentioning, in the midst of BLM, that's just somewhere else where it's being amplified. I think this bias that's ingrained in so many people of like that will cause them to receive different treatment or whatever. And all of this, I think, is because there are these discriminatory policies and there's these oppressive systems. And as Naya was talking about, is simply being a BIPOC person increases your likelihood of living in poverty, and then that's been going on forever. And now there's this connection between poverty and then suffering from COVID. There's that intersectional connection of, if you are lower income or impoverished, you likely live in a different housing situation, or you are having to work on the front lines and you're more at risk for COVID. So I think those are just some social issues that we are in the midst of addressing with BLM, but also we just have to remember. I know for myself, there's this kind of feeling of I'm being desensitized almost to COVID and COVID lifestyle, like because it's been such a long time, I'm getting so used to it because I'm not having to put myself in danger every day. But I think it's really important to highlight that we can't forget how dangerous it really is for those people who do have the responsibility of exposing themselves and having to go to work every day and face like crowded housing and stuff like that.
Yeah, no, I absolutely agree. I just wanted to bring up some that there's like all these fruit and vegetable pickers who are mostly Latinx, and I have read stories that they all sleep in this large room, all of them in bunk beds, and there's not adequate access to bathrooms when they're picking the vegetables or fruit, and it's really inhumane, and still all of these big corporations pay them next to nothing. And even during the pandemic, they don't get really any exceptions, but they just have to go out to work to have food in the grocery stores. And I just thought that was just, I, I was just, I had no words. Yeah. Okay, so just to transition a little bit from that, to tie it in with these big corporations, um, there's certain corporations such as Amazon, Louis Vuitton, or even the San Francisco 49ers that have been accused of taking part in performative allyship. Um, so for example, Amazon, they have a really long history of underpaying and overworking its lower level employees, such as like the warehouse workers and the customer service departments. And I did a little digging, and it says that about 85% of their Black employees hold unskilled jobs. And the worst part is that Amazon only has one Black person on their senior board. And the thing that just really kind of annoyed me a lot was that Jeff Bezos hasn't responded to questions or comments about donating to the BLM foundations or even just supporting the cause and just advocating. What do you guys think?
I think you totally hit the nail on the head when you talk about how, those entry level positions may seem on the outside like diverse or like they have a lot of Black employees. But then when you mention there's this huge problem of, executive boards and the people who are in power and making decisions are, majority white. And there's this whole issue where people might pretend they're listening to their Black employees and they'll say, even companies that seem to be like they're supporting BLM and they're being great, they're making these claims of, oh, we're going to diversify our employees, but it's really just their goal is only in those entry level positions. And yeah. I think in order to see really strong change, we have to make sure that we're diversifying the people who are making the decisions.
Definitely.
And yeah, so I think it's a huge problem, and I think it's tokenistic. And I learned a lot about that from, little shout out to one of my favorite intersectional environmentalists. Her name is Green Girl Leah on Instagram, and she has this whole podcast episode with Michaela Loach where she talks about this issue, and I think it's super interesting. So I will leave that link in the description if you guys are interested in learning more about that. But yeah, I think it's a huge problem. Thanks for addressing that.
Yeah. So anyone else have anything else to say before I move on to the other brands, go into the details?
You can go.
I think that a lot of people can have biases when it comes to who they want on their board and how it will be as how it will look like at their company. And a lot of people are all about first impression, and there can be biases in terms of who gets to represent the company.
Yeah, exactly. For sure.
I actually did a study on this in school, and studied about how Amazon, how they underpaid their workers and made them overwork. And I was really frustrated about this, and hearing about how they treat their Black workers and how there's not very many Black people on the senior board, it frustrates me even more.
Yeah, me too. I definitely feel you. So, just to go into a little bit more detail, so for Louis Vuitton, the creative director of Off-White and the designer for Louis Vuitton, his name is Virgil Abloh. So he posted on his Instagram story that he donated like a mere $50 to the Minnesota Freedom Fund. And something that was so ironic is that Off-White socks, which is the brand that he was the director for, cost more than his donation. They cost $62. And he's even selling masks for $92. And that just made me so mad.
Yeah, it's totally performative.
Yeah, for sure. Yeah, and get this. So the 49ers, so in 2017, Colin Kaepernick, he took a knee, to protest for police brutality, and that actually led him to be kicked off the team. But now, a couple months ago on Blackout Tuesday, the 49ers, they posted a single black square in solidarity. And I just felt like that was a little too performative as well. It felt a little fishy, So yeah.
Yeah.
Yeah. And so now I just wanted to share like a couple of like statistics and studies that I found from an article from the NIH. So basically, in one study, they found that workers most likely to be affected by unemployment. So they are less educated, they have lower economic resources, and they have lower levels of liquid assets. So in a nutshell, they are the most vulnerable of the US population to be laid off without income. So that kind of just ties in with Trump lowering the unemployment paycheck from $600 to $200, I believe. It could be different numbers. But I was just really appalled by that as well. And also, like, considering the fact that a lot of marginalized groups, such as African American, Native American, and Latinx groups, they're underrepresented in professional occupations, and they may be experiencing like all of these adverse economic consequences of COVID-19 at an increased intensity when compared to white and upper class, middle class Americans. And something that, like, one more point that I wanted to say was something called like the multiple role complex in women or moms, because there are a lot of there was a study that a lot of women who were frontline workers, they were having to decide to either balance their time or leave the workforce and become a stay-at-home mom, or even pay for a babysitter. And sometimes they were laid off and they didn't have any way to access childcare or things like that. And so actually 74.9% of hospital employees are women, and they lack formal or informal childcare. And even now, with long hours and maybe low paychecks, like, they will have even less access to childcare. So yeah, feel free to jump in, you guys. Like, this is just so interesting and, I don't know, infuriating at the same time.
Yeah, I love how you mentioned about that women are having to take on all these different roles with schools being shut down and childcare being inaccessible. I did a little bit of research about that for the Instagram Live thing that I did with About Face this past week. But it's totally interesting how women are expected to take on these roles of managing the household while they might have another job. And I don't think it's being acknowledged enough in like media coverage. I think there aren't a lot of resources being provided, and yeah, I just think that's really something important to highlight. Is there's that almost double standard, expectation that women are going to be the ones to hold down the household, and it's just so much extra stress and mental pressure. And there's this fear of, if I'm going to work and my kids are at home doing their school, I'm not going to be there to support them. And it just sets really unrealistic expectations. But then there's also, you have to be able to work and support your family. And it's just hurting people in so many different ways.
Yeah.
And important that you acknowledge that. Thank you.
Right, of course. Yeah, I totally get it, because there needs to be more representation in the media, of course. Yeah.
I think that also it just makes it that much more frustrating that our country hasn't been able to, get a hold on this virus as quickly as some other countries, because people are suffering every day, and I don't care who you are, even if it's not affecting you personally, like, we want this to end as soon as possible. And so the lack of leadership and the lack of ability to contain and, I don't know, it's just totally frustrating. And
Absolutely.
I really hope that we can just wrap it up as soon as possible,
For sure. Yeah.
To these people.
Yeah.
So speaking of the leadership and how our country isn't doing as good as others, have you guys heard Michelle Obama's speech?
At the Democratic National Convention, or?
Yeah, I heard that one. Is that what
I think. But yeah,
night
so I just remember her.
Sorry, go.
It's fine. I just remember her calling out Trump and saying how he is not fit to lead this country, and it just reminded me how he didn't really enforce the rules of wearing a mask, which made this situation much, much worse. And it's just totally not under control.
Yeah.
And he's not really making it better.
Absolutely.
Mm-hmm.
I think that brings up also, like, just how important it is that we vote and how important leadership is in every aspect of our lives, And so if you can vote, like, I encourage you to get out there and vote.
Yes.
Make sure your ballot's getting in. I know there's some trouble with the USPS right now, but if you can go to a drop-off location, do it. If you can vote, if you have the power, make your voice heard and use it, and you can make change.
Exactly. And I also heard that there's delays, of course, with the USPS, so try to vote as early as possible. Get your vote counted, because there could be a chance that your vote could be counted way too late. So yeah, vote.
Yeah, that's just one of the calls to action, I don't know if you guys have any other comments, but if you want, I have just a few things for our listeners, because I know one of the things that we want to make sure we're doing every episode is giving people ways that they can help. So I don't know if you guys have any last thoughts before I jump into those ways that people can help.
Yeah, go ahead.
So basically, I know a lot of you all have heard about the fires that are going on in the Bay Area, and I just want to send love and support to those affected by those fires, and especially those that have lost their homes, because it's like double the impact, as you have no home and it's COVID-19. So I'm sending you all the love and support, and I really hope that things can get better and that we can help everyone who is affected as much as we can.
Yes, hope everyone who has maybe been evacuated or their home's been destroyed is well, and hope that they have somewhere to go or food and supplies, and if not, really try and help them, and just want to send love and support over there.
Yeah, me too. I'm just sending all of my prayers, all of my love. I have actually been personally affected. I have a couple of family members who have actually been evacuated, and so I'm sending all love. I did hear that in Santa Cruz, that a lot of Santa Cruz hasn't been, affected yet but it's really getting there. So I'm just praying that everything will work out. But yeah, sending all of our love, support from this team. Yeah, wishing everybody the best.
Yeah, I'm actually near the Santa Cruz area. I'm pretty close. And just, having the terrible air quality, we can't open our windows, we can't go outside. And I know how hard that is for everybody. But yeah, especially calling out those people who have lost their homes amidst everything else going on. I just am lifting them up and hoping that they can find, safe places to stay, and just be surrounded by love and hope and support. So yeah, thank you, Naya, for bringing that up.
Yeah, and we'll have some links in the description box on just how you can help those affected. And we will also have some other links. Brianna, do you want to tell them what it is?
Yeah, so all of the resources that we're going to talk about today are going to be available in the YouTube description and also on our Instagram, which is at girlsinaction.sf. So look out for those resources there. We're going to have the list of resources for how to help people affected by the fires. We're going to have some free testing locations around the Bay Area so you can get tested for COVID-19. There's going to be lists of Black-owned businesses you can support. Also, another issue that's come up with the fires is it's happened before the fires, but it's kind of coming into the light right now, is a lot of inmates and prisoners are being used to fight the fires, and it's prison labor. And so we're just going to call out a few companies that utilize prison labor regularly and then offer some alternatives that you guys can use to swap those out. Donate to your local food banks if you can, especially now with the fires. We're going to have a link where you can find a food bank near you that takes donations. Donate to homeless shelters if you can. So yeah, all of these are going to be on our Instagram and our link tree, which is in our Instagram bio. So make sure to check those out. We'll also link some creatives and some people who are just spreading general awareness. So make sure to look out for it. Thank you all so much for tuning in today. Again, our Instagram is girlsinaction.sf if you want to check out those resources.
Yes,
Yeah,
thank you so
all
much
for
for tuning
tuning
in.
in.
Yeah, we'll see everybody in the next episode. Take care, everybody.